Good evening, people. How are y'all? Somebody just let me know that y'all can hear everything. I hope everybody saw my notes. It would be not. I'm not trying to say it's going to behoove you, but it'd be nice for you two guys to get a pen and paper so y'all can take notes because there's gonna. It might be good for y'all. And how about that? Um, I. Whoops. Sorry. I hear somebody. I don't know if that was me or what. Hang on. I gotta find my.
No, I'm here.
What's up, Holmes? We're gonna get you there. All right. So. Um. We're gonna start tonight. Just let everybody know. I'm just gonna be straight up honest to y'all. I despise teaching this lecture. I have always despised this lecture. It's just one of those that it is what it is, and we're gonna get through it. So thank you, Victoria. I appreciate you laughing at me. We're gonna get through it tonight. It's not a super long chapter, so we we'll go through what we got to go through, and if not, we're not gonna try to stretch it out. I despise that. All right, so we'll get off to the races. How about that? Click. All right. Same thing we always talk about applies fundamentals of knowledge to provide basic emergency care and transportation based on the assessment findings for an acutely ill patient. I think it's almost in every single chapter the same way. Gynecology, organization, and management of shock associated with vaginal bleeding. We are going to talk about anatomy, physiology, assessments, and findings and management of vaginal bleeding, sexual assault, to include appropriate emotional support and infections. All right, so here's where we go. We're going to hit this part of the case study. We'll go over at the end. I am always open to open mic discussion at the end to talk about this case study, if y'all would like, or for the ones that can. And the ones that can't, please follow in the chat if you're able to. All right, so here's your case study. You arrive at a small but tidy apartment to find a young woman lying on her left side on the sofa with her knees pulled up to her stomach. She tells you that she has had a significant aching in her stomach for over an hour that was not relieved by taking antacids. She also notes it got worse when she walked to the bathroom and she thinks she has a fever today. I'm going to leave that there for a second in case y'all are taking some notes or whatever y'all want to do to it. Next. So we'll talk about these at the end, but I want y'all to understand. Uh, what are some of the possible causes of abdominal pain? All right. So hang on one second. I kind of forgot what I was gonna. All right. Nope. I'll address these two. So y'all tell me real quick. What are some of the possible causes for abdominal pain? Ectopic pregnancy. Good one, Victoria. Appendix. Yep. Good job, Travis. I'm not calling no names, but probably eating a lot of crawfish when you really should be paying attention to class. That's in my opinion. Victoria Gas, gallbladder. I'm just saying maybe this crawfish is going to affect your gallbladder. All right, so I got some stuff to hopefully add to that. So general causes of abdominal pain includes trauma, GI bleed, good one, and that's actually what I was just going to put. Gastrointestinal complaints due to viruses, allergic reactions, pancreatitis and appendix, and peritonitis or other causes of GI irritation, like Travis pointed out, GI bleeds, as well as a kidney stone or other urinary problems, in addition to gynecology problems such as ectopic pregnancies, pelvic inflammatory disease, which is also called it's also called PID. So later on, if I start to abbreviate, y'all understand what PID is. Sexual assault or a pregnant woman going into labor may cause abdominal pains in females. I'm pretty sure that's going to cause it because it contracts muscles in the stomach and uterus and all that. So I'm pretty sure. All right. So now number 2. What questions related to the patient's pain can you ask to try to determine the possible cause of discomfort? So Y'all can be double male partners, double females, male female partner. It don't matter to me. However y'all want to do it. Victoria saying, how long have you been in pain? Victoria again, point exactly where it hurts. And when on that one, let's use an index finger. Don't use your hand. Say, oh, it hurts in this area. That's not pointing. I need you to point. Travis, does it radiate? Right. Where? Show me where it hurts. Does it hurt anywhere else? Mickey, I like to hat off under that any chance you're pregnant. Well, if you're of childbearing age and there is still potential chance that you can be pregnant unless you can get a documentation where they had their tubes tied, snipped, burned, yanked, whatever you want to call it. So unfortunately, I always say, is there a chance you can be pregnant? Oh no, there's no chance. I haven't had sex in forever. Doesn't mean that's still not what I asked. Is there a chance of it? There's always a chance. Travis, have you had this pain before? Very good. When was the last time you had a menstrual cycle? Correct. When's the last time you had a bowel movement? Man, y'all own it. You're good. So, some other stuff that I was going over. So you can use the OPQRST mnemonic. Does everybody knows what that is? OPQRST. I hope everybody does. I'm on it, but we're gonna go over it. It's onset, provocation or palpitation, quality, region or radiation, severity, and the timing. All right. So to obtain information about the patient's pain, did the pain start suddenly or did it come on slowly? That's important. What does it feel like? How intense is it on a scale of 0 to 10? Now, 90% of the people we come across are like, oh my God, it's a 10 because you have a splinter in your finger. Well, that's maybe a 10 to them, but I will say it for the men that are in here. You ain't gotta listen to me if you don't. Our pain scale is way different than the females on here. So when we say we had the flu and it was the man flu, so in other words, our pain was probably like a 3, but we made it like a 9. I'm just gonna straight up call it out like it is. It is gonna be that way, but I need to know what it feels like. Is it sharp? Is it dull? I need you to describe that to me. Is it consistent intermittently, or the location of the pain may also be helped pinpoint the cause? Like I told you, like Victoria pointed out, point where it's at. Travis, describe the pain, burning and stabbing. Correct. Is the pain worse on one side? Does it come more intense when you go to the upper abdomen or the lower abdomen? Or does it diffuse throughout the entire abdomen? So here's the thing: when you ask questions people about their abdomen, don't say, "Well, does it hurt all over?" Well, yes, it does. Well, does it hurt down here on the lower part? Like, show me where on yourself. Okay. All right. Tell me where it stops hurting. And the reason why we ask that is because if you say, so in other words, you're saying it's all over. Yeah, it's that. Well, that really doesn't just point out where I need it to. Now, does it radiate anywhere, such as into the back? Could it be their kidneys? So that's something that's some of the questions we want to ask, and it could help. All right. So if y'all notice the color change, orange to yellow. So now you know, kind of give you an idea when I put something in there versus they put in there. All right. So women are uniquely designed to conceive and give birth. Understatement. Women are susceptible to more problems that do not occur in men. 100% true. All right. External femoral genitalia. We have the vaginal opening, the labia, the clitoris, and the perineum. It's an area skin between the vaginal and anus. As you can see there, if y'all don't know by now, that's another reason why I hate teaching this chapter. All right. Back to our case study. When you ask her for the OPQRST questions about her pain, she tells you that she just finished her menstrual period and thought at first the discomfort was related to that. But this pain is much stronger than her menstrual cramps, about a 6 out of 10 on the pain scale. It is primarily in her lower abdomen and is a pretty constant achy feeling. off of that, does anybody else have any questions that you want to know about that right there? Just that. Travis, is the pain on her right or left side? Well, it's a good one. All right, so now here, you do your primary assessment and the vital signs and find her heart rate to be 110, which is strong, regular pulse. Her respiratory rate is 20 breaths a minute and regular. Her oxygen, her O2 sats are 98%. Her blood pressure is 114 over 86. And she has an oral temperature of 101.6, which now we can't take oral. It's all got to be temporal, but maybe I need to rewrite that. You proceed to do a secondary exam and find that her lungs are clear and her abdomen is soft and non-distended, but she has tenderness over her entire lower abdomen on palpitation. What quadrants are those? Somebody tell me that. See how much y'all retain. Left and lower right quad. That is correct, Travis. I appreciate it. Thank you. If I had a sticker, I'd give you a golden sticker for paying attention. All right. What other signs and symptoms should you ask about to help narrow the possible causes? Somebody, now's our chance. What do we want to know? Y'all mighty quiet tonight. I mean, sure, somebody because they're sitting over there eating, but again, I'm not calling nobody out. I'm just making statements. For y'all don't know why I keep doing that. Somebody told me prior to class that they're eating crawfish, so I'm having to rub it in. Travis, you're right. Any vomiting, any bleeding, has she recently had a baby? Those are all important. Because if it is related, maybe she is having secondary issues to the baby. Maybe they did not remove everything. Maybe she started bleeding. Vomiting is just as important because does she have any recent surgeries that I would ask too? Any does she have any discharge? That's correct. We want to know that. Um, it is just as important as all our questions that y'all are asking because that is super duper duper important because we need to document all of this. Okay, every bit of it. All right, some anatomy and physiology we're going to go over tonight. Ovaries are the primary internal female reproductive organ. If y'all don't know that by now, we probably need to talk on the side. So the ovaries lie on each side of the lower abdomen and produce an ovum, which is obviously the egg. A fetus develops from a fertilized ovum. Fallopian tubes connect each ovary with the uterus. We got a pretty. When I go to one of our next ones, I broke it down a lot for us. All right, so the uterus is the muscular organ where the fetus grows during pregnancy. The narrowest part of the uterus is the cervix, just saying, which opens to the vagina. The vagina is the outermost cavity of a woman's reproductive system, and it forms the lower part of the canal. All right, so we're going to break this down. So this one's going to take us a minute, all right? So the figure shows the internal female genitalia. All right, so the tubes, oops, wrong mouse. Let's get this one. So here's our tubes right here. So the tubes that connect each ovary with the uterus are the primary location of fertilization of the ovum is the fallopian tubes, which y'all see it's already marked there. All right. What is the muscular organ where the fetus grows? Also called the womb. It's responsible for contractions during labor. Does anybody remember that one? Uterus. All right, good job. All right, so what is the primary female reproductive organ that produces an ovum or an egg that is, if fertilized, will develop into a fetus? So now y'all see why I asked y'all to take that pre-test, kind of get y'all's general knowledge, and I'm hoping after this y'all will pick up and do at least way better or at least the same score. Ovary, that's right. So what is, let's see, what is an infection of the fallopian tubes and the surrounding tissue of the pelvic? So my question is, there's a specific type of infection that's right, PID. It is pelvic inflammatory disease. Like I told y'all, is known as PID. What is the third? What is the lower third or neck of the uterus? I've never ever heard it called the neck of the uterus. That was new when I started learning. Yes, that's correct, Victoria. It is the cervix. When I had to redo this so I could teach y'all tonight, I was like, it's a neck? What is that? All right, so an overgrowth of bacteria in the vagina characterized by itching, burning, or pain, and a possibly fishy smell discharge. Anybody want to tell what that is? It's going to be different. Yes, it's the same thing, but the reason why I wrote this is because it is out of a test book that does not have to do with y'all's, but they're calling this a bacterial vaginitis. So first thing I thought of is a yeast infection, but they're calling it that's completely different because it is bacterial and that's what they get the name from. All right. So the last one I got for y'all right here is the area of skin between the vagina and the anus is what? Y'all need me to go back on the back slide just to so y'all can look at it. Y'all let me know. That's correct. It's perineum. All right. So we're getting there. Well, guess what? Now it's time to ask y'all some more questions. You ask your patient if she has any other symptoms, and she has had some nausea and some burning when she urinates. She also notes that she has had a smelly white vaginal discharge since her menstrual period ended. She says her period was normal in length and flow. All right, so I know you have already got some minds bred up. What's going on? Hang on to that. You assist the patient onto your ambulance cot and notice that she walks the few steps to the cot bent over with a slow, shuffling steps because of her discomfort. That right there should tell y'all something. Does she use tampons? Nah, I don't know. We'll find out in just a minute. I like your question though. All right. What do you think may be possibly cause of your patient's problem? Are there any additional treatments you can perform? Y'all hang on a second. Y'all keep thinking about that. I gotta look at something. Never mind. Wrong one. All right. All right. Let me catch back up this. All right, Victoria, did she forget one side and now it's infected? Yes, that happens. Oh, no. I get it. By no means can I say I know, but I get it. All right. So the location of the pain is important. The burning on urination and the vaginal discharge, along with the patient's sexual history, is important just as well. Seems to the point that sexual transmitted disease or another cause of PID, other than repeating vital signs and placing the patient in a position of comfort, you transport them, provide comfort care, and providing emotional support. There are no BLS treatments that you can do for them. Although the case is primarily a BLS call, ALS may be called for pain management on a long transport if permitted by your protocols. Or if the patient is hypotensive or conditions get more worse and she's just not stable. Victoria says, how recently has she had sex? So um, let's remember when we're asking these questions, a lot of times you may get these first phone call, these 911s on some younger females, preteen and or new teenagers, and kind of get where we're going for that are just now learning what sexual activity is, and mama calls 911 and daddy's like, what the hell's going on? So they're not going to answer you on what's going on. Well, most of the time they're not. They're going to be very discreet, very secretive about their answers, because one, they may not want to get in trouble, and depends on their age, and nor do they want their parents to find out that they are sexually active. So think about that when you get ready to ask some of your questions. All right, so an ovulation and menstruation begin in puberty. Most of us know that happens to men and women besides the ovulation. Men don't have that. Onset of menstruation is called a menarche. I learned that one the other day. And that it usually occurs between the age of 11 and 16. Now, they have noticed that it happens younger in some females. Some regions have them younger. I don't really know. I was reading all that, and I was amazed by different parts of the world and different parts of what time that they come start their menstruation and all that stuff. So any female who reaches menarche is capable of becoming pregnant. So y'all remember that. They're of age. So as this book says, that they can become of childbearing age of age 11. Where I live, our trauma center actually, please don't take this the wrong way, but the record of the youngest child giving birth is 8. Victoria, then they become stark raving lunatics and should be avoided. Whew. I'm gonna leave that quiet. So women continue the cycle of ovulation and menstruation until they reach menopause. Menopause marks the end of menstruational activity and usually occur around the age of 50. Some people have it earlier. I've noticed a lot of people potentially fix that, before they get there, maybe on their second child, but they still do have hormone issues. The hormones are going to be the ones that cause them to go crazy again. We also may want to ask if foreign objects were used. Oh, yeah. See, that gets pokey and very tricky. Uh, they have minor mood swings and hot flashes. Um, yeah, yeah. So just be cautious. I'm not looking forward to that. I have a 6-year-old. Whew, it's already killing me, and I know what's going on. So remember these things when you get ready to ask these questions, and sometimes it may be easier for, like myself as a male paramedic, it may be easier for me to kind of step out and let somebody else take over. I prefer to work with female partners because of this situation, and or sexual assaults, rapes, stuff like that, because I have many a times put my partner in the back of the truck with a female patient and gone to the hospital. For the long time, Mississippi didn't allow that. Downgrade of care, basically what it was. I didn't really care. I mean, it's the betterment for the patient. They're more comfortable. Maybe because they don't want to open up to the male and tell them what's going on, because a male maybe just sexually assaulted them. They've been raped for a long time. They don't. I get it. I mean, we all understand, but it may be one of those times that you just, as a female, be like, "Hey, Wally, I got this." Roger that. You're not gonna hurt my feelings. I promise you. But just remember your audience when you interact with these patients is really what I want to tell you. Um, so each ovary produces an ovum in alternating months. Whew. Each month, one ovum is released into the fallopian tubes. The process of fertilization begins in the vagina. Sperms are deposited from the male's penis, passes through the cervix to the uterus, and up to the fallopian tubes. And we thought gravity won sometimes. So the we talked about that. Some women experience minor cramping and pain during the release period. I think minor is out of the question. Some have major to, I don't know. The process, let's see, just make sure I read my notes correctly, that I got everything attached here. So The embryo attaches to the uterine wall and continues to grow, and that's kind of where the child is at until the womb, and then they start moving on. Everything's got to grow. It's just not there on the initial part. So if fertilization does not occur within about 14 days of ovulation, the lining of the uterus begins to separate and menstruation occurs. Bless them. Bless them is all I can say. I will tell you straight up, God made me the right way that I am and not to have menstruation because couldn't handle it. I love being a paramedic. I love taking care of people. I don't want blood on me. So when it comes to something like this, I'm like, girl, you tell me what you need. I'll just hand you all the stuff. You take care of yourself. So the menstrual flow continues of blood from separated lining. So it's just ripping. It's ripping the skin, and basically it's shedding old stuff from 14 days ago, and it's ripping everything out and pushing and passing it on. So it's not, when you think about the entire process, it's not a pretty process at all. I can completely understand why somebody's that's having their insides ripped out is now not in the best mood of the world. I get it. I would want to be left alone too. Female hormones produce the primary and the ovaries control the process of ovulation and menstruation. No, no, no. All right. So we're going to repeat the vitals taken during transport and respiratory rate of 18 breaths a minute. Heart rate 104. Your blood pressure is 116/90. Your patient continues to rate the pain a 6 out of 10 and continues to feel more comfortable with her knees pulled up as she lies on her left side on the ambulance cot. So somebody asked earlier, what side were you hurting on more than the other? Well, now we know her right side hurts the most. All right. Gynecology problems often present with abdominal pain that is usually located in the lower abdomen quadrants. The pain is most often achy and diffuse rather than unilateral if related to sexual transmitted disease, especially if the pelvic inflammatory disease is present. Other symptoms may include bleeding, vaginal discharge, pain or burning on urination, painful intercourse, vaginal itching, fever, chills, nausea, vomiting. Sounds like COVID. No, I'm just kidding. Or general malaise. So they tired. They shit hurts. All right. So now, patient's recent sexual history may provide clues. I've already asked that question to the possibility of pregnancy related, such as an ectopic pregnancy. I think I remember seeing that one. An STD or potential sexual trauma, assault, or rape. Although it may be uncomfortable to discuss such personal details like we just went over, it is important and we need to know that because it may point out possible serious disease or potential crime. It is usually best to ask these questions in a setting. Oh, did I say that already? Maybe it is best to ask them in the ambulance. So here's what I want y'all to get out of that. Hang on, let me get back to the slide that I want to see. So here, y'all see these little words right here with a slow shuffling step because of her discomfort. So with PID, we call it the PID shuffle. They will not pick their feet up and hit the ground because it hurts. They will shuffle and scuff their feet across the ground. So that right there is telling you that it's a PID. So she has PID written all over it. Now, not saying that there may be some other issues there, but PID, oh, wait, there it is your recent of this call. Only thing you can do for them as a basic, man, load them and go. You ain't got to get no hurry. Take them to the facility they want to go to. Continue to monitor your patient, check your vitals, provide comfort care. That's it. That's all you can do. There's nothing else. All right. So cause of gynecology emergencies are varied, ranging from an STD to trauma. You should recognize and properly manage the female patients with any kind of abdominal or pelvic pain. Now, do I expect you to know these 110% and treat them out in the field? There's nothing we can do. We can't fix a PID outside. She needs a doctor, some antibiotics, and some rest. I can't fix vaginal bleeding in the field because it's not. I don't have them tools. But we can provide comfort care. We can provide some general care to this patient. And if it's bad enough, call and let the paramedic or the advanced with an ALS unit that is allowed to give narcotics provide some pain management. Why not? It's what it's there for. So, that being in mind, think about these things and recognize the call and the complaints on what you see when you arrive with this patient. Let them know, oh, I think what's going on is this. So, moving on to PID. So, PID is an infection of the upper organs of the reproduction. So, it's going to talk to messes with the uterus, the ovaries, fallopian tubes. Occurs mostly exclusive in sexually active women. Mostly, it's seen it in other ones. Disease-causing organisms enter the vagina and migrate into the urinary cavity. If an infection expands to the fallopian tubes, it will cause scarring. It will cause, oh crap, I just went blank of what the word is. Well, memory's short. Can result in increased risk of ectopic pregnancies or sterileness. Ectopic pregnancy is a pregnancy that develops outside the uterus and can be life-threatening. A lot of times it's life-threatening. If an infection expands to the ovaries, it can lead to the development of life-threatening abscesses. So they've got they need to see a doctor. OBGYNs, their best friend. Most common presenting signs of PID is generalized lower abdominal pain. Other signs include abnormal and foul-smelling vaginal discharge, increased pain with intercourse, a fever, general malaise, and nausea and vomiting. Majority of the times you're going to get a complaint, they not just going to be straight up honest and be like, yo, I got this foul smell. That's more of a personal thing. They're going to try to more just tell you that their stomach just hurts. I just don't feel well. I've been sick to my stomach. You're going to have to ask these questions. Hey, are you sexually active? Well, they're going to look at you and be like, the hell you want to know that for? It's just, you see why I hate this class? Because it's like, ma'am, you sexually active? What the hell are you asking that for? What you need? I mean, like I've had people when I've asked that, you ain't getting my number. I'm like, God dang, I'm not asking you on a date. I'm trying to take care of you, take you to the hospital. So be cautious how you ask them. Your attitude, your comfort, your bedside manner can help you in asking these questions. Just your overall care, your appearance can help that. That's the reason why I like working with female partners. It's easier. So, sexually transmitted diseases or STDs can lead to more serious conditions such as PID. Chlamydia, most common STD in the United States, caused by bacteria, usually mild or absent. Some women may report lower abdominal pain, lower back pain, nausea, fever, pain during sexual intercourse, or bleeding between menstrual periods. An infection of the cervix can spread to the rectum and cause progressive processes. Hold on. Let me scoot clear. I need to put my glasses on real quick because I am. Look at there. I can see that now. Infection of the cervix can spread to the rectum and can progress to PID. I didn't know that either, but I figured that was important. So I had to put them in the notes. So be cautious. STDs, chlamydia. There's several of them out there. I had the numbers when I was doing my homework to teach. This has been since Thursday I've talked to you guys. We have had a horrible, horrible past few days. Multiple alarms going on here. We lost complete power, shut down. We've had two patients, one med flight that came out and picked him up at 2:30 in the morning. So we've where I'm functioning. How's that? So I don't remember your numbers when I was talking about the STDs. I'm sorry. I'll get better next time. All right. So bacterial vaginosis is the most common vaginal infection to affect women ages 15 to 44. Well, I'm just going to say that's a very broad age range. So, sounds like bacterial vaginosis is probably going to be a test question. I'm just throwing that out there. Normal bacteria in the vagina are replaced by an overgrowth of other bacteria. Symptoms include itching, burning, pain, and a fishy, foully smelling discharge. If it's untreated, it can lead to premature birth or low birth weight and causes a pregnancy. I've seen where your child will have to be put on antibiotics to begin with. Hopefully, the meconium sac didn't rupture and they sucked it in their lungs, because now that's another issue. So this is making patients more susceptible to other serious infections and causes a PID. So they can have PID still in the hospital as they're trying to deliver this child and function after the delivery, natural delivery or C-section. So that can be a big issue when it comes down to it. Gonorrhea. Gonorrhea caused by bacteria that grow and multiply rapidly in warm, moist areas of reproductive tract. That's 100% check right there. Cervix, uterus, fallopian tubes in the women. Urethra in the men and women. Bacteria can also grow in the mouth, throat, eyes, and anus. Women may present with painful urination, burning, itching, yellowish, or bloody vaginal discharge, and a blood associated with sexual intercourse. So that's kind of how you can tell the difference between PID and gonorrhea is the yellowish and a bloody discharge. Um, so a lot of the ones won't have that when they're talking about. It is painful for sexual intercourse, but they don't normally bleed on that. Hey, Victoria, such a wonderful time to eat. Maybe somebody's crawfish are not that good right now. So severe infections persist with cramping and abdominal pain. That's caused by nausea, vomiting, and bleeding between periods. These symptoms indicate it has progressed to PID. Um, Untreated, it can enter the bloodstream and spread to other body parts, including the brain, and that's the worst that it can get. You don't want the brain to get infected, because then the brain can't shut off. Oh, Mickey, I wasn't calling you out. I don't know what you said. I didn't drop no names. I'm done with my crawfish. Thank you. I appreciate you letting us know that you're eating it too. That's mighty nice of you. All right, vaginal bleeding. Bleeding may be considered menstrual bleeding and overlooked. So sometimes that may be from the patient's side, that they're just like, oh, it must be my cycle. Maybe this one's not as hard as it normally is. I don't really know how you judge them. That's outside my realm right there. But obviously, there's a ranking. So some possible causes, y'all can see abdominal menstruation, vaginal trauma, ectopic pregnancy, spontaneous abortion, cervix, polyps. That's what I was looking for earlier, is polyps. And then it could be cancer. So those are some of the symptoms that some possible causes there. All right. So it's not break time yet. Darn. Patient assessment. Obtaining an accurate and detailed assessment is critical when dealing with the gynecology issues. You will be able to gain only a primary impression of the problem in the field, but through patient assessment, you will be able to determine how sick the patient is and whether its life-saving measures are needed. If you do a very good assessment, you will get that. That's if, because a lot of people ain't going to want to go there. I'm just saying. So make sure you do an assessment and ask the right questions. Anyone who neglects to consider a gynecology cause and a woman of childbearing age who complains of abdominal pain will miss the diagnosis 50% of the time. So when you're dealing with any patient, if I can teach y'all anything that is a female, that is of childbearing age, always ask, are they potentially pregnant? Yes or no. Even if they say, oh no, there's still a very good chance that they could be pregnant. Now, I'm not gonna say if I pick up a nun from the church, probably gonna believe her answer, but it doesn't mean that she can't have any other issues. But also check their sugar. Hint, hint, because I'm not gonna forget that one. Victoria, I ain't digging around in nobody's vaginal. Oh no. Oh, and then sometimes when you deliver those babies, you don't want to do it either. I delivered more babies than I can literally count on two hands. I love it. I think it's beautiful. I think it's a wonderful process. I think childbirth, yes, it is overwhelming for your very first time. It is very complicated, but it's a very beautiful process. And just think this beautiful little body comes out. So, that's just my tidbit. Sorry. All right, so scene safety, we know this, but they specify it down to each call or each chapter we're going to go over here. Help deliver 5 babies in the field, and that's awesome. My day one as a paramedic, we had a massive fire in another county that we got called for because at the time we only had a ladder truck. We're the only ones in the area had one. We were over there for like 8 hours fighting this fire. I get back, get the trucks clean. I'm wore out. Just slap dab. It's cold. Tones drop. We delivered this tiny, tiny baby. Was able to fit in my hands. Went all the way to the hospital. It was my very first child delivery. And we're standing on sign, and everybody looks at me and they're like, wow, this woman's supposed to deliver a baby. I was like, well, y'all get ready. Well, y'all ended up, everybody was looking at me. So it is pretty, you will deliver a lot. If you get one, you're going to get another one. So on this scene, will you need assistance? How many patients do you have? If you have one that is of trauma, you are going to need multiple backups. Not just saying, because if you're the first one there and it's a multi patient call, you're the last one to leave. A lot of paramedics want to take the worst and leave. That's not how you do it. The first one to get there is the basically scene commander and is the last one to leave. So I always harp that over time and time again. What is the nature of the illness? Obviously, we know it's a gynecology issue. Have you taken standard precautions? Well, I sure as hell hope so. That's their blood. I don't want that. Gynecology emergencies can involve large amounts of blood and bodily fluids potentially contaminated with organisms and bacteria that can cause communicable diseases. Where or what position was the patient found? Is this potentially a crime scene? Mentally take a picture. I'm not saying physically. So is the scene clean, filthy, or is it just destroyed? Do you have evidence of a fight? Is there potentially skin underneath your female fingernails? Clothing was like on a shooting. Don't cut through a bullet hole. Just don't do it. Mickey, do not let a patient that claims sexual assault to shower. Correct, 110%. Thank you for pointing that out. I think sexual assault's maybe in a little bit further down in this chapter, but still, thank you for pointing that out. I know after dealing with the ones that I have, that's the number one. Or you get the call after they've showered, just say, "Hey, this is what's happening." Well, you got to lug in, but um, are alcohol, tobacco products, or drug paraphernalia present? It is very because they can get spit residue. They can get from the tobacco. They can get alcohol if there's a bottle around. Obviously, drug paraphernalia. Does the patient live alone or with others? If a crime scene, you may be required to testify in court regarding conditions on arrival. Your documentation needs to be accurate and thorough. Involve the police if any type of assault is suspected. Also, majority of your hospitals now have SANE nurses, and those are your certified assault, nursing, something. I forgot what they're called. But anytime there's a rape, a SANE nurse has to be there. In case of sexual assault, it is important to have a female EMT provide patient care. True, 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 true. But if you ain't got one on the truck, you ain't got one. You're gonna do what you gotta do. Victoria says, do not put their clothes in a plastic bag, only a paper bag. Yeah, I mean, yeah, since we live in the South, that's 110% because it gets hot down here. So, speaking of, it's really hot out here. Just letting y'all know that. We're gonna hit this last one. We'll take a break. I know it's early, but so the MOI may be easily understood from the dispatch information. We know our dispatchers can't do it. No, I'm just kidding. We only gonna know what they hear, what they're told. They can't make up shit. They ain't got no camera. They ain't got no drone that just goes out there and see what the scene looks like. So you don't know. Um, and other patients, patient history may reveal the nature of the condition, because even if you've been there and you're like, oh God, we're going back to Teresa's house. Oh my God, what's her complaint now? Well, it might be something serious, and we're just giving her shit because we've been there 500 times. Victoria, it is so the body fluids don't mix in case the. That's correct, and it won't run in a plastic bag. In a paper bag, you mean? Maybe. Okay, that's what I thought. All right, yeah, we're done with this. I want to take a quick break. I need to go answer a phone that I just ignored. So give me. Let's come back at 7:05. I really need to make sure just in case this phone takes phone 7:05 to start back in. Okay. See you in a minute. What's up, folks? I'm back. I don't know if everybody's back. I'm just catching up on y'all's notes over there. So Travis, I know when it's going to be the first week of May. Your question is, does anyone know when we will get our skills location? I don't know. I know it's the first weekend of May. Let me message Rob real quick and see what he says. Uh, uh,
Chris, Rob told me that the one for Lafayette, the one in Lafayette, Louisiana, is scheduled for the first week of May.
yeah.
And if everybody doesn't know, we do have a uniform that we have to purchase.
Yes, please. Does ever? I mean, let me. I'm gonna ask Rob where the boot camp is gonna be, and hey, Travis. Once I get all that, I will share it. And for the ones that may already have it, please share that information on Facebook. I will. Working on that so I can get it posted on Facebook for everybody. Um, I'm hoping that the Facebook page is helping keep y'all informed. Jesus, my wife just sent me a picture of the weather that's coming in tomorrow, and that does not look good. Anybody around Central Mississippi, y'all better hang on. I don't know if that's just me, but um, all right. But Travis, yes, I will. I have just sent them a message, Robert and Krista, to get that information for you guys. If I don't have it before class is over, I will post that on the Facebook. If I don't, I will make sure Rob does. Okay. All right. On to bigger and better things. Let's learn something. All right. So your primary assessment. Excuse me. Form a general impression. Obviously, we know that. We're going to do that from the door as far away as possible. Is the patient stable or unstable? What is the AFPU scale determine? Use the AFPU scale to determine the patient's level of consciousness. And you can use that from a couple of things away. Mickey, thank you for posting that. Mickey's saying 511 style black or navy and steel or composite boots and a black Aries polo. Um, I'm gonna have to get me an Aries polo. Just look important because I don't get to see y'all. So I'm trying to see if there's something I can work out with my relief about potentially coming out a little bit later since it'll be right here in Louisiana, but we shall see. At least I can put some faces to names that keep popping on the screen. All right. So ask these questions from the doorway. You can assess them as you're walking up. Hey, can you hear me? Well, if they look at you and they're like, yeah, or they moan, well, maybe you can. Maybe you just don't want to see us. No, it's called a check, baby. A check. Um, so always evaluate the airway and breathe in immediately. That's important. People got to breathe to make complaints. If they're not breathing, they're not going to be talking. But if they're breathing, if they're talking and say they can't breathe, well, then quit talking. Maybe you can breathe in. Circulation. Palpate a pulse and evaluate skin color, temperature, and moisture to help identify blood loss in a patient. Tells you if they're shocky, if they're clammy, it's that kind of like that they just don't feel good. If there's significant blood loss in the patient, may not be demonstrating obvious signs of shock because they're hypovolemic. Keep that in the back of your mind. That's important too. That if they lose a lot of blood, they probably passed that shock stage and now they're hypovolemic. Most causes of gynecology emergencies are not life-threatening. If a patient has signs of shock, a weak or rapid pulse, or pale or cool or diaphoretic skin, then rapid transport is warranted. That's because they've lost a lot of blood. All right. We're going to start asking questions. We're going to investigate. We're going to see what's going on and ask that. Hopefully, we can ask the right question and they will give us some answers to what's going on. So some questions may be extremely personal to the patient. We've talked about that. Be very sensitive to the patient's feelings and protect her privacy and dignity, just because you don't want to be asking these questions in the middle of Walmart and this chick's passed out and maybe she's bleeding and there's an issue, or who knows, but you just don't want to ask these questions out just to keep it's somebody's mother, daughter, sister, just think about that. An adolescent girl may want to keep her sexual history private from mom and dad. Yes. From abdominal pains, ask about onset, duration, quality, and radiation. Provoking or revealing factors and associated symptoms such as syncope, lightheaded, nausea, vomit, and fever. So those may tell you right there, be like, okay, so we know it's your menstrual cycle. Okay, how heavy is it? That may tell you, oh, well, maybe they've lost a lot amount of blood, or they're not compensating well, or you just don't look so good. What's been going on? And then they tell you of what potentially has been going on. Hang on, Robert has answered me. So are y'all wanting? Hold on. Any chance y'all can get in my class? They have questions. How's that? Trying to invite them to our class. So Rob may join in a few minutes. All right. So when we ask these questions, we're building that history. Um, Sorry, I was on two different screens, uh, and it confused me. I'm simple-minded. All right. Um, it's kind of the same thing. That's why I was kind of. Sorry. Okay. So this one's going to abdominal pain, and this one's speaking specifically to vaginal bleeding. So for vaginal bleeding, the things you need to know is you want to ask how how long it's been there. What's the duration and quantity of sanitary pads soaked? Oh, I hate sanitary pads. I just hate that word. I don't know why. And associated symptoms such as a syncope, lightheadedness. We talked about that again. If they've used multiple pads or tampons or whatever device they may use, it that may tell you more of their blood loss levels. That may tell you how long it's going, the onset, the duration. Well, it's been 8 days for some odd reason versus a normal 5 days for me. So those things need to help you with your history. It's helping you build a background story for your patient. So when you start doing your history taking, so again, we talked about all these mnemonics. We've talked about the abilities. Um, so let's use something simple. We talked about OPQRST a minute ago. Now we're going to talk about using sample. Uh, Specifically on allergies, maybe let's keep that, because if they're having respiratory issues, are they on any type of birth control devices? Now, they're talking about pills and devices. There's so many different kinds out there. Whew. So that just write it down. That may be like the Johnson and Johnson, something seal. We may not know what that is, and that's cool, but write it down, because somebody at the hospital is going to need to know that information. You want to ask them about what current medical conditions that they have, and how long and about their last menstrual period. That's important because we need to start building, like a background. Okay, have you noticed that they've been starting getting heavier since when? Um, Sorry, I had to change back over. Victoria's asking, and Mickey says, ask if she has a low blood count, correct? Do they have any blood thinners or large quantities of aspirin? So very, very good points. Very good points. Because all of those can make them bleed longer. They could have a clotting issue that's causing, and they're gonna know that. Like if they have a clotting problem, that's gonna be one of those things they pick up on it. They're gonna know those things. Where is my? Okay, there it is. All right. So now we move into our secondary assessment. Here, a secondary assessment may be performed on the scene or en route to the hospital, as we know, because we're either going to stay and play or we're going to load and go. Well, what's the difference? It really depends on you and your ability and your comfort level. There's some things you're just going to build over time. Now, I'm not really saying that 90% of the time you're going to load and go over. You cool with Facebook posts? Yeah, yeah, yeah. Yes. All right, so there's actually going to be a Facebook post about the uniforms, the location, the all the stuff that's required for the boot camp. That be awesome. All right, so cool, no big deal. So give us a little while, and that'll be put out there. Um, Pertinent secondary assessment findings should always include vital signs, blood pressure, pulse, skin color, and vital sign, blood pressure, and all that. Said orthostatic vital signs. Listen to their lungs. What's their pulse pressure? What's their SpO2? Just normal things like that. Check their abdomen. Do they currently have bleeding, or is it hit and miss? Is it you're getting there and they're like, oh well, I haven't, had to make a change of my pad in the last 45 minutes. You called me 20 minutes ago. So do your time there. And what is their normal? I'm sorry, I'm not trying to make fun of this, but what is their mental status? I know. Yeah, I'm sure there's going to be some pun poked here, but you remember they not the most lovable person at this time because of what's going on. So be nice, be nice, be nice. It's the best I can tell you. So physically, what do they look like? So here, it says this physical examination should be limited and professional. If you have to look and you feel like you need to look, you can ask. I'm not sure you're going to be granted that permission. Uh, so, I mean, y'all think about that. Protect their privacy. Few women are comfortable with having their bodies exposed. I would never ever try to expose them. Always keep them covered, keep them modest. Put a blanket cover on them. Be advocate for her modesty. I'm a huge fight for that. Even when they're pregnant, I've delivered a baby in the middle of the Pearl Walmart in Pearl, Mississippi, and I've had sheets held up on either end of the aisle so people couldn't come over and look. Um, I fully believe in privacy. Uh, so focus your physical examination on the NOI and the patient's chief complaint. Again, it's very even sometimes it's harder for me when I respond to a pregnancy call and they're saying like I feel pressure, da da da, and I'm like, oh, I gotta look, ma'am. Let me tell you what, I gotta look. So when you do that, just remember you gotta be respectful. Respect their privacy, guys. I'm sorry, it's just easier for women to do this. Um, Sometimes women are not comfortable doing it onto other women, and that's fine. That's okay. But always be very, very careful. Oh, Victoria, I'm gonna let y'all read that. I don't know if I want to read that out loud. Loves you, girl, but I ain't doing that one. All right. So vaginal bleeding. Is the bleeding asked about? Use external pads to control the bleeding. Keep the possibility of hyperfusion or shock in mind because they're losing so much. Always ask if there's pain associated with the bleeding. Never insert anything to the vagina to control the bleeding, even a tampon. Never, ever, ever, ever. Um, yeah, thank you, Mickey. Tell them what you're going to do and make sure that they're okay with it. Even when you're trying to deliver a baby, hey, this is what's fixing to happen. I know that you probably may not feel comfortable, but either you gonna have a baby in them blue jeans, or we gonna get them off, and we gonna prepare for this, and me and you gonna get to know each other very well. But we're gonna keep this very professional. So make sure that they understand what you're gonna be doing. Observe the vaginal discharge. Make observations about the discharge. Note that I mean, even if you got to state color, smell, quantity, it's very hard to quantity on blood though. Fever, nausea, and vomiting are considered significant in gynecology emergencies because a fever and is significant for an infection. Syncope is considered significant if treat and begin to shock. Whew. Vital signs. We're gonna do these. How often, y'all? How often we're gonna check their vital signs? But I want you to check heart rate, rhythm, and quantity, respiratory rate, rhythm, and their quantity every 15 minutes. Good deal. Capillary refill, blood pressure. Considering obtaining orthostatic vital signs if bleeding is known or suspected. Pay special attention to the presence of tachycardia or hypotension. It could indicate shock. So if your heart rate's up and their pulse is low, I mean, dude, there's so much that can go on to create these issues. Let's be cautious of that. So if you have to check, make sure you check it multiple times. Keep their vitals up. If you notice a change in their vitals, go from there. Note that and explain it and continue on. All right, monitoring devices. We want to talk about a pulse ox, non-invasive blood pressure, monitoring or continually track the blood pressure. It's just your life back 12. Just hook them up to the 12 and let it go. ARES out here is no matter what set to 7 minutes. We changed our settings. I wouldn't suggest to do that to your facility unless you can explain why. But we do ours every 7 minutes out here. It's just a medium for both of us. We've agreed to. It is always recommended to assess the patient's first blood pressure with a they want you to manually take it. I despise this Signum monitor because it's just say a manual blood pressure. I know that's a professional way to say it, but I get tongue twisted every time I try to say that. But they want you to manually take it too. All right, we know this. Repeat your assessment every 15 minutes. If it is a non-critical, if it is critical, you do it every 5 minutes. There are very few. Hold on. Identify and treat any changes in the patient's condition. Pay specific attention to the needs of your patient. If they need blankets because they cold, it's because they're losing blood. People, you got to keep them warm. Um, accommodate her desires for conversation, or if silence, don't just be like, "Hey, so what's going on?" Come on, bro, stop. Um, there are very few interactions with a gynecology emergency. Nah, we're not gonna see them every single shift. We may see them once a quarter. So think about that. Whoa, my bad, wrong spot. Sorry, wrong mouse. I didn't even see what it did. We good to go. So we want to treat them for hyperfusion or shock. Keep the patient warm. We told you about that. Place the patient in a supine position. That may be the best for them because keeping them flat, blood's not continuing to flow. It's harder for if you need to prop their legs up. That's fine in a Trendelenburg position. Rock along with that, but sitting at a 45-degree angle is potentially going to make them continue to bleed no matter what. Always think about this too, right in here, these two words. Always consider giving oxygen. And also ask for ALS interception if you're a BLS truck, because they're going to need fluids. Here comes the yawning. It's continuous, told you. Now I've started yawning, it's over. They're going to need to replace those fluids somehow, some way, so something, and you as a BLS unit may not be able to, well, you're not going to be able to do that. So you're going to need some help. Get somebody out there that's got some fluids that can help you out. We know this, communication, documentation. Make sure your report is on point. You got a shitty report, and that's the easiest way to say it. You're going to get perceived as a crappy basic, as a crappy provider, and every time you go into a facility, they're like, oh, he's back. Well, you don't want that. I would rather over document on the littlest things than under document and downplay something. Think about that. When you go somewhere, the doctor that doesn't let you talk and it's like, oh, okay, this is what you got. No, I didn't say that. That turns you off versus the doctor that sits there, listens to you, pays attention and says, so let me get this right. You're having da 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 da. Is that correct? You want to document like that. All right, so maintain the patient's privacy as much as possible. If you're in a public place, move her to the ambulance. Have a female participate in the patient's care if possible. If you don't, you can't do it. Determine the cause of the bleeding. Sometimes you can't. Shit happens. You got to roll with it. If bleeding is of less importance than treating the patient for shock and transporting her. You may just not be able to tell where it came from, but just treat the patient, not, like I always say, treat your patient, not your monitor. Same thing. Treat your patient no matter what. Most women will use sanitary pads to control the bleeding before you arrive. Use sanitary pads on external genitalia to absorb the blood. I don't know any service that I've ever been a part of that has extra sanitary pads. Just saying, I don't know. Document the number of sanitary pads that were used or saturated with blood. Sorry about that. If the woman has a tampon in place, it is not necessary for it to be removed. Don't worry about it. External genitalia has a rich nerve supply, and this makes injury to the area very painful. I don't know why we had to guess that. That's pretty obvious, but they had to put it in there. All right. Treat external lacerations, abrasions, or tears with sterile compress. You're not gonna pack the wound, just cover it. Let them apply pressure. Use local pressure to control bleeding. It may just help with them squeezing legs with a sanitary napkin there. That's all the pressure it may need. Use a diaper-typed bandage to hold dressing in place. Never seen one of those. Good luck on making that. I'm sure you could use it out of Curlex and maybe an ABD pad, but I don't know how you're going to add extra padding after it's soaked through, but we'll figure that out later. Under no circumstance, do not pack the vagina. Just don't do it. It's not a good thing. Assessment and management of specific conditions. We talked about PID. We know they're going to complain of abdominal pain. We've gone over that. And painful usually starts after the normal menstruation. Inquiring about the date of the last menstrual period is very important. The pain may be worsened by walking. We told you it's a PID shuffle. Shut up, Victoria. I'm sorry, that was rude. I apologize. I know you're laughing at me. I'm trying my best. So when they walk, it's actually like if you tap on a hollow organ with your fingers when you're accessing the abdomen and that organ is sore, they're going to feel it. So you can imagine trying to walk and having pelvic inflammatory disease. It's painful. That's why they shuffle their feet. So again, we call it the PID shuffle. And they walk like that. They slide their feet back and forth because it hurts. If you see that, telltale sign right there. Non-emergency transport is recommended. PID itself is a seldom a threat to life, but if serious enough to require transport for evaluation in the hospital. They may tell you now, we're full. Some places may let you get a refusal on that because they don't have ability to treat them, and they may need to go to their local doctor, the trust care, to the first aid band-aid shop that's open on the corner, because there's no room in the home for these people at this time because of COVID still rampant. All right, so going over sexual assault for the next few slides. Sexual assault and rape are common in the United States. Unfortunately, 1 in 5 women has reported being raped. 1 in 4 women will be sexually molested, or often before the age of 12. EMTs are called on to treat victims of sexual assault face many complex issues. Issues range from obvious medical ones to serious psychological and legal issues. Document, document, document. That's all I can say on this. So you may be the first person that has contact with this after the encounter. How are you going to manage this situation and have lasting effects on your patient and you? Professionalism, tact, kindness, and sensitivity are important. I can't even add to that. I literally was trying to edit this slide, and I just sat there for like an hour, and I was like, I don't, I don't know what else needs to be said, because you may see some things that will affect you. Some providers.
Chris, I have something that I can add to that.
Go ahead, baby. If you want to do it, rock on.
With sexual assault, whenever you arrive on scene, if the victim is there, make sure the person that is the alleged assaulter, I don't know if I said that right. If they're there, watch what you ask.
And you may not know.
Yeah.
And very good point. Thank you for saying that. You may not know who that is, but again, that person may stand over them kind of like a dictatorship, and they're going to try to answer the questions for you. When you say, ma'am, can you tell me how long this has been going on? She's only been doing this today. Thank you, sir. I appreciate that, but I'm trying to get her to answer. I need the information.
But you also have to consider it could be a man or a woman.
Correct. It can. I'm not just picking on anything. Very good point, too. It's very tricky when it comes to this. I don't think it's taught enough in EMS on how we as providers could take this class and we learn more and more from it. It is sensitive. It's very hard to go and take care of a sexually assaulted person. So be cautious. Like Mickey pointed out, how you answer those questions, how you ask those questions, because of your situation. So be cautious when you go there. When performing your assessment, be aware of drugs used during sexual assault or rape to incapacitate a person. Initially, remember the event should create suspicion. You may not know either. You may come up on an abandoned facility because they found this person there, and you don't know if there's drugs in the system. If these drugs are still in the patient systems, you may see hypotensive, bradycardia, abdominal complaints that may be from the assault, difficulty breathing, seizures, coma, or even death. Very true in all of this. I have 2 instances that I've run on that do have lasting effects. Couldn't do nothing to one. She actually died, and the other one was a guy, and he just goes out of jail, and it was bad. I mean, both situations were bad. I hated I even ran on them, but they were what they were, and I did everything I could. But it's I don't care what kind of person you are. If you don't take this and semi-personally and treat this person with utmost compassion, that's probably not the best class you should be in, because we all need to be compassionate no matter what call, event, anything that we go to, because we're there to do something about the problem. Um, and it could be, with us just notifying the nurse that we believe that this person was sexually assaulted. So I don't want to say we pass the buck, but they are the ones that may have to deal with it. And sometimes it's easier for them if the person that did the assaulting can be removed from, like, oh, hey, look, we're going to take this damn person over to X-ray. If you don't mind, just hang out in the lobby. We'll come get you when she comes back. and they may not come back and get him or her or whatever. So, good point, Mickey. I appreciate that. Right there on your notes, 100%. If your patient looks scared with a person in the room, don't ignore that. Respect that. That is a, and if the person doesn't want the patient to ride alone, I need to be back there with them. No, we don't allow riders. That's a good part. If they don't want to do it, be like, all right, we just got to call, get PD in round or something, dispatch. Correct. Don't ask a lot of questions with that person in the room. Thank you, Victoria. Because now you're just opening the door. You're just provoking an issue that shouldn't be poked in a bad situation. I really know how to put that. You can generally expect law enforcement involvement sometimes, maybe after the call, maybe after the case. Attempts to immediately gather a detailed report from the victim may cause him or her to shut down. If possible, give the patient the option of being treated by a female EMT or male. It's completely, and it's okay to call for another unit. If you're a double male truck and this is a female, call, they be like, dispatch, I need another truck out here. They don't have to know why. They're just going to drop you another call, another tag, or whatever else y'all want to call it. So it's okay to ask. So here we're going to medically treat. Is he or she physically injured? Are there any life-threatening injuries present? Does the patient complain of anything? The psychological care of a patient. Do not pass judgment on this patient. Whew. Protect him or her from judgment of others on scene. Move. Tell these people to leave. Gots to go. You need to get out. Oh, sorry. Crap. You need to get out of my call. You need to get out of my scene. You guys to go. Don't cut through any of the clothing. If you have to take the clothing off, cut down the seams. Like, if y'all don't know what seams are, it's on the side or the inside of the pants leg. Cut the seams. Don't throw anything away. Everything's important. We talked about this already. Place blood-stained clothing and anything else that could be evidence in a separate paper bag. It may be necessary to persuade the patient not to clean himself or herself, like that was posted earlier. Where is this at? Patients should also be discouraged from urinating, changing clothes, moving their bowels, or rinsing out his or her mouth. Patient will be photographed and examined by nurses trained in, that's what I was talking about a while ago, and the same nurses trained sexually assaulted examination and management. Offer to call the local rape crisis center for the patient. The hospital can get that a lot faster than we can. Get a professional advocate to the scene and may help the patient deal with the trauma. We can do that at the hospital. Take the patient history and limit any physical examination to a brief survey of life-threatening injuries. The patient report is a legal document and it will be subpoenaed if it goes to court. Keep the report concise and record only what the patient stated in their words. Mickey says, take note if your patient has fake nails or they're missing any. Oh, yeah, see, and that's just stuff they don't teach you. You just got to learn that over time. Thank you for bringing that up. There's so much that I want to say, but it's kind of like it's hard to teach everything. I mean, it's really hard to teach anything on that. Use quotational marks when reporting the patient's version of events. Be like, he or she stated. Focus on the facts. Bear in mind that rape is a legal diagnosis, not a medical diagnosis. So if you put it in there, sometimes you may get asked on the stand, well, how are you sure that this was rape? So it's easier to say this patient's declared sexual assault because rape, I'm not a legal attorney, so sexual assault's the best. In your book, 23-1, treatment principles for sexual assault. That's another little guide. Some things you can do there. All right, so in the first part, if y'all read my notes, we talked about taking notes. So this is where another, where y'all going to want to take notes. Oh, my brain just went out of luck. All right. I'm going to read this to you. You ready? You respond to the home of a married 27-year-old, I think that was, I don't know why the W's in there, but that really doesn't make any sense. 27-year-old woman reporting abdominal pain and vaginal bleeding. The bleeding is moderately heavy, and she has had regular menstrual period 2 weeks prior. She denies any recent trauma and has a history of miscarriages. She has soaked 3 sanitary pads in the last 2 hours. Her airway is patent, and she has an A&O times 3 to person, place, and thing. Or person, place, and time, I'm sorry. Although she feels dizzy, she does not have a fever. You ask her to lie instead of lit, and maybe we want her to drink something, I don't know. But so you ask her to lie supine and obtain her vital signs. So why we want to do that is you're checking if there's a greater than 10 point change in her vital signs. Remember that. Her vitals are currently 104/62, pulse rate of 104, and respiration is 16. She agreed to go to the ED, but fears her husband will be upset due to the lack of medical insurance. So I hope y'all are taking notes, because we got some questionnaires coming up. What is the initial consideration specific to this case? The primary assessment of the patient should include the husband arrives and is very upset, and what are you considering and what that you are considering transport? What is the best thing you can do? What is your primary impression of the patient's emergency? And the patient tells you she feels blood coming from her vaginal area. She gives you permission to look, and you observe moderate bleeding from the vagina. What should you do to manage the bleeding? Are y'all ready? We ready to go next? Think she's having an ectopic pregnancy, which can be fatal. So, oh no, sorry. Saw a scratch on my Mac, and I was like, no. All right, so I want you to answer the next few questions, and then we're going to talk about it at the end. What is the initial consideration specific to the case? A, ensure the scene is safe. B, don appropriate PPE. C, call for a female EMT. D, confirm police have been called. All right, y'all are paying attention. Next, the primary assessment of the patient should include quickly identifying any life-threatening injuries, an extensive trauma exam, an extensive medical exam, an extensive trauma and medical exam. I really didn't see you. Y'all still typing A? Okay. It got me confused. There was so many A's on the screen. All right. We'll go over the answers in a minute. All right. So the husband arrives and is very upset that you are considering transport. What is the best thing to do? Call for police backup. Inform him his wife has a potential life-threatening condition. Ignore him because the patient gave you legal consent. Obtain online medical consultation for assistance. Next one. What is your primary impression of the patient's emergency? PID, ectopic pregnancy, an STD, or bleeding of an unknown origin. I didn't have an abbreviation for that. That's why my question marks are there. All right. So the patient tells you she feels blood coming from her vaginal area. She gives you permission to look, and you observe moderate bleeding from the Vagina. What should you do to manage the bleeding? Apply direct pressure using trauma dressings. Pack the vagina with trauma dressings. Ask the patient to insert a tampon. Place a sanitary pad over the vaginal opening. All right, folks, I am going to back up to question number 1. I really appreciate all y'all answering because y'all are on the right track. So here, what is y'all's answers again? I'm sorry. D, aspirate or squeeze? Yeah. All right. So back to number 1. I think majority of you guys said A. Is that correct? I'm just gonna go. I think majority of y'all said that. So, so Jones and Bartlett says correct. Correct. I will agree with you, Victoria. Safety is number 1, but they are saying that the answer is C. Call for a female EMT. How do they know we're not female to begin with? I mean, I don't know. I'm just saying. But Jones and Bartlett is saying C for this answer. Now, that's up for discussion. I'm more than welcome if whomever can turn on their mics and we can discuss this. The ones that you can't, please go through the chat. That's cool. And the ones that will catch this over the web, I don't expect you to chat to us because that'd be crazy if you talk to yourself. Anybody?
Anybody what?
So, does anybody want to know what's y'all's consideration why they think they're calling for a female EMT on this?
They
Because
want
she's
you
a
to
woman.
call for a female EMT because, one, you're supposed to have your PPE on before you arrive on scene. Then you assume you have to make sure your scene is safe. So you've already put your PPE on. You've already assumed you've already ensured your scene is safe. So you need to call for the female EMT.
I get it. I mean, so here's my question: How? What if? What if you don't? What if there's none? I don't like. My thing is I don't. I get their response. I do get it. Travis, I'm assuming they are saying this because not all females are comfortable dealing with this. And you know, again, that's why I said I particularly like working with a male female truck. It's easier. It is, but my first instinct is like, how do they know this is not a double female truck? And of course, yeah, that's off the wall. I get it, but I think, Mickey, I think you're on the right track because you're saying you should have your PPE on and you should have already assessed the scene. Once you figure out what's going on, then you realize that you need to call for a female EMT. That maybe there's no explanation when I got these questions out the book. I was like, whoa, what is this? Why is it like there was no like I could not get you an answer. I'm sorry. Uh, Females are more comfortable with a lady presence, right, Sherry? I agree. And that's you got some strange dude that's fishing to try to take care of you and potentially ask if they need to. Oh, can I see if they're still bleeding? Well, no, you can't. So, all right. So moving on to this one. The primary assessment of the patient should include.
That's for me and you.
I think again, majority of us did say A, and that is correct. Life-threatening trump everything else. So
Look,
that being the case,
I can eat all that whole bowl and it doesn't affect my cat.
is the most important thing. Let's move to the next one. All right. So the husband arrives. Well, I can't read that from my screen. There's a big old sidebar. All right. So the husband arrives and is very upset that you are considering transport. What should you do next, or what should you? So I muted everybody. I don't know if y'all can hear now. So everybody's saying inform his wife has potential life-threatening condition. That is correct. That is what the book So now y'all see what the difference is. This is more online of a National Registry question because it's asking questions that you would just be like, what? So that's another reason why I post a lot of these questions on Facebook, if y'all hadn't noticed, is I want you guys to start. You got to think test wise, okay? All right, so the next one. I don't remember what question number this is. 1, 2, 3, 4. All right. So what Victoria says, explain, then have your partner go call PD if your husband gets irate and back away to the truck. I agree with you. I do agree with you. That is, and if you don't carry mics or radios with you, that's the easy way to do. So on this one, what is your primary impression of the patient? Do y'all think he has a PD, PID, ectopic pregnancy, or an STD, or bleeding from an unknown origin? What do y'all think?
Chris, it could possibly be D.
Ding, ding, ding. That's
Because the husband's getting upset because we want to treat the wife, and he's getting upset because they don't have insurance. How do we know that he didn't cause this injury that's causing the bleeding, that's causing her to lose the presumed pregnancy?
we don't. It could be from a sexual assault. I know husband and wife. I get that, but doesn't mean that their partner can't cause it. So I, I originally, when I took it, I put D down. Because I was like, well, I get it, but you know what I mean. But you're right. I agree with you. We don't know. We're just in our head. We're thinking potentially ectopic pregnancy because of childbearing age. Some of the symptoms that they're saying, um, but the vitals point to an ectopic. I give you that. I'm right with you, Victoria. But again, we don't know. I mean, this person may not tell us. Dude, the guy I had in here the other night that flew out of here lied to me and didn't tell me something until we were putting him on the helicopter. You know you're leaving. There's no reason to not tell me something. But these people just may not tell you. So, unfortunately, it's just an unknown. So, I mean, y'all give a good fight for that one. All right, so then this is the last one. The patient tells you she feels blood coming from the vagina. She gives you permission to look. You observe some bleeding. What do you do next? And no, you can't put a tourniquet over it. Come on, y'all. Jeez. Yes. Yes, y'all. D. We're gonna play some uh of some sort sanitary pad. And I think they're going with like an ABD pad, a trauma pad to that area, and have them apply the pressure. That's going to be very, very awkward. You get out of the back of the ambulance, and you have your hand between this lady's leg trying to hold pressure. That's that's just not. It's not gonna look good for y'all. I'm telling you. So just don't do it. Uh, period. Victoria. Jesus. I ain't gonna read your response. All right, folks. Listen, I told y'all it was a short chapter. I'm giving you a 15-minute break. I can't. I'm not gonna tell y'all to break and come back and end the class. So that's it. That's it for the night. We're done. It's the best I can do. I appreciate y'all's feedback. Really appreciate y'all chiming in and helping as going through the class. Some important information. Speaking up when y'all feel it's important. I'm open to that. Please always unmute your mic if you have some better information to provide. I'll promise you I will never tell you no. But I may lose my train of thought, so y'all may just know that I may be like, well, I don't know what I was gonna say next. I ain't mad at you. Thank all y'all. I appreciate your time. I know we're having class on spring break, so I'm sorry. Apologize about that, but it is what it is. So I know y'all are patiently waiting for me to shut up so y'all can get this. But Victoria, will you please copy this in the chat because I still can't type in the chat. So there's your code, and I want y'all to understand once y'all realize what that means. It's awesome. I'm just gonna let you know I come up with a really good one tonight. It's fantastic. Hashtag. You gotta forget the pound. Pound best instructor. Pound BSTINST1. Y'all are welcome. I know y'all see that. Don't forget the pound. It is pound BSTINST1. Thank y'all so much. Y'all have a wonderful night. Be safe, and we will see y'all Thursday. Good night.